Hi, I am CETIRIZINE. So my generic name is CETIRIZINE. So my brand names are Gertec, Gertec Allergy, Children's Gertec Allergy, Children's Gertec Hives Relief, Pediacare Children's 24-hour Allergy, Allergic, and Ulcer. My chemical names are pregnancy category is category B. So drugs which have been taken by only a limited number of pregnant women and women of childbearing age without an increase in the frequency of malformation or other direct or indirect harmful effects on the human fetus have been observed. Studies in animals are inadequate or may be lacking, but available data show no evidence of an increased occurrence of fetal damage. This drug should not be used during pregnancy unless the benefit outweighs the risk to the fetus.
Cetirizine's mechanism of action. Cetirizine is a human metabolite of hydroxyzine, is an antihistamine. Its principal effects are mediated via selective inhibition of peripheral H1 receptors.
Drugs pharmacokinetics. Absorption. Cetirizine was rapidly absorbed with a time to maximum concentration of approximately 1 hour following oral administration of tablets or syrups in adults. Comparable bioavailability was found between the tablet and syrup dosage forms. When healthy volunteers were administered multiple doses of cetirizine, approximately 10 mg tablets once daily for 10 days. A mean peak plasma concentration of 311 ml was observed. No accumulation was observed, and cetirizine pharmacokinetics were linear for oral doses ranging from 5 to 60 mg. Food had no effect on the extent of cetirizine exposure, but Tmax was delayed by 1.7 hours and Cmax was decreased by 23% in the presence of food. Distribution. The mean plasma protein binding of cetirizine is 93%, independent of concentration in the range of 25 to 1000 ml, which includes the therapeutic plasma levels observed. Metabolism. Cetirizine is metabolized to a limited extent by oxidative alkylation to a metabolite with negligible antihistaminic activity. The enzyme or enzymes is responsible for metabolism have not been identified. Excretion. Primarily excreted in urine, 50% as an unchanged drug. A small amount is excreted in feces. The mean elimination half-life in 1 to 46 healthy volunteers across multiple pharmacokinetic studies was 8.3 hours, and the apparent total body clearance for cetirizine was approximately 53 millimeters per minute.
Indications of cetirizine. So, cetirizine is usually indicated for the relief of nasal and non-nasal symptoms associated with seasonal or perennial allergic rhinitis in adults and children 12 years of age and older.
Drugs contraindication. YRTEC D cetirizine pseudoephedrine tablets are contraindicated in patients with non-hypersensitivity to any of its ingredients or to hydroxygen. Due to its pseudoephedrine component, GRTEC D cetirizine pseudoephedrine tablets are contraindicated in patients with narrow-angle glaucoma or urinary retention and in patients receiving monoamine oxidase or MAO inhibitor therapy or with 14 days of stopping such treatment. Also contraindicated in patients with severe hypertension or severe coronary artery disease, and in those who have shown hypersensitivity or idiosyncrasy to its components to adrenergic agents or to other drugs or similar chemical structure. Manifestations of patient idiosyncrasy to adrenergic agents include insomnia, dizziness, weakness, tremor, or arrhythmias.
Cetirizine have side and adverse effects. It will be shown in this table. Central and peripheral nervous system, fatigue, dizziness, somnolence, and headache. In gastrointestinal system, abdominal pain, dry mouth, diarrhea, nausea, and vomiting. In the respiratory system, coughing and bronchospasm. in the eyes, ears, nose and throat, pharyngitis and epistaxis.
Nursing responsibilities. Assessment. The nurse must include the history of the patient like allergy to any antihistamines, hydroxygen, narrow-angle glaucoma, stenting hepatic ulcer, symptomatic prostatic hypertrophy, asthmatic attack, bladder neck obstruction, phyloduodenal obstruction, and lactation. Physical, skin color, lesions, texture, orientation, reflexes, affect, vision examination, adventitious sounds, prostate palpation, and renal function test. So during the nursing intervention, so the nurse must give without regard to meals, provide syrup from form or chewable tablets for pediatric use if needed, arrange for use of humidifier if thickening of secretion, nasal dryness become bothersome, encourage adequate intake of fluids, then lastly provide skin for uricapnia. So the teaching points for the nurse to make, so make sure that take this drug without regards to meals. You may experience these side effects like dizziness, sedation, drowsiness. Use caution if driving or performance tasks that require alertness, thickening of bronchial secretion, dryness of nasal mucosa or humidifier may help. Then report difficulty breathing, hallucinations, tremors, loss of coordination, irregular heartbeat. The nurse should refer to manufacturer's summary of product characteristic and to appropriate local guidance. So after evaluation or desired outcomes, so the nurse must evaluate the therapeutic response, patient compliance to drug therapy, then evaluate patient understanding on drug therapy by asking the patient the name of the drug, adverse effect, and the indication. So that's all for the CETIRIZINE drug.